Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello, friends, and welcome to episode 73 of the Aesthetic Doctor Podcast. This is Dr. Borger, and today I'm going to talk to you about what I think the future of aesthetics is like. So I get asked this question all the time because as I lecture quite extensively nationally and internationally, I have people come do advanced one-on-one injection trainings with me. I guess I'm considered a key opinion leader by all those standards. So I get asked all the time, what do you think the future of aesthetics is like? And also I business coach. Not only do I one-on-one personal coach, but I also do business coaching in the world of entrepreneurship. Of course, there is a lot of aesthetic providers that come to me because I have built this very successful practice with very little starting capital from the ground up, and we can go into that another day. But because of that, I get asked all the time, what do you think the future of aesthetics is like? And this episode will be released still in 2024. It's going to be right around the end of October, beginning of November. And so I figured I'll give you my predictions and we can see together which ones of those ring true. So number one, the biggest thing that I think I see about the future of aesthetics, and I don't think anybody argues with that, is the fact that aesthetics is going to create all of the visual media, the social media, the Zoom meetings, is not going away. People are going to continue to seek aesthetic procedures, and I think sort of the market will be growing with the patient population becoming more diverse, both in terms of age, in terms of race or ethnicity, and in terms of gender. So I think the aesthetic industry is gonna keep growing because tied to that, what we see as the role of age and aging in our society is changing. I don't know if you have seen some of the comparisons of what in the 80s somebody who was in their mid-40s looked like to what somebody who's in their mid-40s looks like now, or people like Jennifer Lopez who are like defying what aging looks like. And so all that trickles down to the general population where I'm going to say I'm 44 now. I don't feel like old. I know I'm aging and there's definitely some wrinkles around my eyes that no matter what I do seems to always be there. I feel more tired. I feel like I need more rest. I don't have quite the same energy, but in the end I've gained wisdom. So I do notice that there's some aging going on and I'm embracing the aging, and I think my 40s have been like my most phenomenal, best decade. And at the same time, when I think of my mom at the same age, she was like a lot older, or she seemed a lot older, and she presented herself as a lot older. And I think, again, if we just look into what women in their late 30s, mid to late 40s, mid to late 50s, 60s, and so on looked like 20, 30 years ago versus what people and celebrities look like now, there is a huge difference. And also, like, longevity is a thing, and again, aging is taking on a different meaning, and like, I don't feel old, so I don't want to look old. So the aesthetic industry, as I said, I think is just going to continue to grow. And I think it's nice also that as we grow the industry, that all of the segments are going to grow of it. So that's my number one. I think the aesthetic industry is going to continue to grow. Number two, I see this trend, which I totally love and I'm totally on board with, about a more natural enhancement and natural look, which I completely, as I said, supporting, that I think is going to keep going, where we're really looking at what are some of the root causes of aging. Like we get loss of collagen, we get loss of elastin, we get loss of hyaluronic acid, we get disorganization, we get loss of volume, so on and so forth. And I think we're thinking more about restoring some of that youthfulness in a very natural way. Again, this goes with a lot of the makeup trends, some other minimalism trends, some sort of more natural trends that I think, and I have always supported this, that I want to make you look like you, just more rested, maybe 10 years ago. That is always my goal, right? So along with this, trends that I see continue to be on the rise are biostimulators. Biostimulators are amazing, whether we're talking about hyperdilute radiesse, whether we're talking about sculpture, just things that are injected into your skin or dermis, and then they stimulate your body to regenerate its own collagen. They help with some naturally occurring volume loss, but instead of there being like a filler substance that stays behind, what we inject really just leaves almost like a matrix around which your own collagen begins to grow. So I am a huge fan of Sculptra. I think I've talked about it on the podcast. Actually, I'll probably do a whole episode on biostimulation, but I think the biostimulators are amazing because, again, they do that same thing. We are going to stimulate my own collagen with my volume loss and my lower cheeks and my temples, all of that stuff. So again, that's going to be a much more natural approach. Same with PRP, right? We know that PRP, or platelet-rich plasma, uses your own growth factors, uses your own platelet to stimulate regeneration. So any sort of natural regeneration, I think, is going to be on the rise, because the other thing is we have seen some of the bad celebrity examples when things like too much filler has gone overboard. Do I think there'll always be filler? Absolutely. And with filler, you can absolutely very artfully restore some of the volume loss that people have, and certain areas are going to need filler. In the past, there was this trend also pushed by the companies that was like, oh, this is what this person looks like with 7 syringes of filler in their face. And I think I have never been a huge fan of that trend, but I think it would be more like, hey, this is what this person looks like with 2 syringes of filler in their face and some vials of hyperdilute radiesse or some vials of Sculptra. And I think that is going to be more of the global trend. And as I said, we've all seen Madonna, who went way overboard. Demi Moore has been borderline there once in a while. Right now she looks great, but also that celebrities have embraced this much more natural look versus just adding more and more filler and then looking completely unrecognizable. Do I love filler? Absolutely. Do I think lip filler is always here to stay? Absolutely. But then again, as we see in the Kardashians, who are so much trendsetters, they're now going for 1 or 2 syringes versus before when we're like, oh, to get these lips, you're going to need 4 or 5. So again, it's a more like a natural enhancement of your natural beauty. And that's always what I've been a fan of. Along the same lines, I think laser treatments are going to continue to be super duper popular and grow because, again, a lot of what laser treatments do, and of course there's many different lasers out there, most of us, if we're going to go more natural, less makeup, if we're going to try to look more like the best version of ourselves, and that's really what it should be all about, right? We're going to want to have beautiful skin. And what a lot of the lasers do is really do that, make your skin more beautiful. Take away those age spots, the sunspots, the dyspigmentation, take away the redness, the veins, or at least improve the appearance of that. And that's one of the things that I find a lot with my patients. You guys know I do a ton of IPL and vascular lasers and things like that. And the amount of times that I've heard people be like, oh my God, I used to have to use so much makeup because I was covering up X, Y, and Z. And now I just use a sunscreen, or I just use a light tinted sunscreen, or I just use like a light tinted moisturizer. on top of whatever versus having to do all of the stuff is unbelievable. It is like the story that I hear all the time, and nothing makes me happier because it means that women are so happy with their skin, and men. It's just that most of the time women tend to wear more makeup. Again, just going with heteronormative standards here, that they feel like their skin is beautiful enough to be vulnerable enough to show it in a like more natural, and if I use the word naked, it's just what comes to mind, but in a very naked kind of vulnerable way, that they're like, wow, I was always so insecure about these spots or these veins or these blotches or these whatever, and so I was trying to cover it up, and now that's gone or lessened. I feel so confident to let people see my actual skin. The same obviously goes with any fractional rejuvenation, that it just helps your skin be more and more beautiful. With the aging and the loss of elasticity that comes with aging, of course, aging happens in multiple dimensions. And we know, again, a lot of that has to do with the loss of elastin, the loss of collagen, the loss of hyaluronic acid in our skin. Any skin tightening procedure is going to be continued to be desired. And I was presenting at the biggest laser congress in the world, really, in April. And really what everybody is trying to figure out is how to do skin tightening more effectively. Right now, radiofrequency microneedling is the gold standard for skin tightening. We have the Matrix Pro by Candela. It's amazing. And so I think those procedures are going to continue to be very popular. Also because we know all of the amazing GLP-1 weight loss drugs. So a lot of people are seeing the results of weight loss on their face, which can be a little bit of extra sagging skin. I've had a couple people that say, oh, I've had a radiofrequency microneedling procedure. When do I need another one? And right now we say, you probably want one to start out with for every decade of life, and then, do one every 6 months to a year so that you can keep your fibroblasts turned on, so that you can keep your skin regenerating and looking young. So that is really also like an ongoing effort. It's not I did a series of this 4 years ago. What next should I do? Again, you've aged in those 4 years, and we're going to continue to stimulate those fibroblasts, continue to stimulate that elastin, the collagen, all of that stuff. With that being said, I think good quality topicals to combine with all of these procedures and combinations of those procedures. Really, I think, like, for example, to say, let's do some radiofrequency microneedling and then Sculptra, and then more radiofrequency microneedling and then Sculptra, and so on and so forth. And the same thing really with topicals. We are really finding out a lot of what topicals do. I'm sure there's going to be some that we're going to find out were fads, but again, the growth factors, the exosomes, the peptides, good quality SkinCeuticals, so that we can really optimize, again, how our skin looks, give our skin the nourishment, and give our skin sort of the love that it needs, versus filling it with crappy, cheap filler products and just slapping something on our face. So again, high quality dermaceuticals and the use and the combination of energy-based devices such as radiofrequency microneedling, such as fractional ablative, non-ablative lasers, such as IPLs, vein treatments, all of that stuff in combination with good quality dermaceuticals to really bring out your best skin. And then the last thing that I'm going to say about what do I see the future of aesthetics at is that the market is growing, and I really think and hope that quality and education is really what people are going to be very discerning about when they see their injectors, right? Because none of these procedures are without risk. And like I've said, I have spent so many years in medical school, residency, fellowship, taking all these courses, treating all these patients, and I now travel internationally to teach other people about energy-based devices and lasers, and I have people come to me all the time to do their advanced injection training, and I keep learning and I love it. And I have reached a skill level that is an expert level and that has taken time and effort and money to master. When people then come and call and they're like, oh, how much for a syringe? It like totally misses the point. Yes, everybody has a budget. However, I don't want aesthetics to ever be commoditized because it's not the same. Because you're not just paying for the syringe, you're paying for my artistry, you're paying for my expertise, you're paying for my ability to manage complications when there's any, you're paying for physician given care. And to then say, oh, this new person who's maybe not a physician, who just opened up their med spa and did 2 weekend courses and injected 5 people, charges less than that, like, you're welcome to go there and do that. But don't think that a syringe in their hands is the same as a syringe in mine. I think makeup artists and hairstylists have done a really great job recognizing expertise. Like, for example, you want Bobbi Brown to do your makeup. I don't know if she's even available to hire. You're going to pay like thousands and thousands of dollars versus, you can go to Sephora and have the girl at the makeup counter do your makeup for $40. The same with my hairstylist. I have never once said, oh, how much is this like one color foil? Like, she does it, she's amazing, she's well trained, and then I pay. So I really want an aesthetics to be quality and expertise and all of that to be as recognized as in other things. It's the same with art, right? You're not going to pay the same for art. You're not going to pay the same for designer clothes versus what JCPenney has. So I think it's the same in aesthetics. As the industry grows, those of us who are thought leaders and educators and all of that, there is going to be a differentiation. And yes, you know what? If you want your budget Botox, you can get your budget Botox. And if you want my level of concierge care, like everything else, like that is going to be priced at a concierge level. Not saying that it has to be too expensive or anything like that, but it's not like that in any other industry. Whether we talk about fine dining, whether we talk about everything else, I don't know where in medicine we have gone to the point that it's all supposed to be the same. Even with clothes, it's not the same. Shoes, anything really. So I think it's going to be the same where, the unit prices, the syringe prices, the whatever prices are going to be varied based on the skill and expertise of your injector. And you can then, and also the level of service and the time they spend and everything that they provide, right? So that is my quick prediction of what's the future of aesthetics. As I said, I get asked this question all the time. So I figured might as well answer it on the podcast. The aesthetic industry is going to grow. I do think that practitioners are going to differentiate themselves. Energy-based treatments are going to continue to grow. Combination treatments are going to continue to grow. And then I think the whole natural, more anti-aging. And with that also, what I forgot to mention, I think there's going to be huge emphasis also on prevention and pre-rejuvenation, so that we're not just thinking about, oh, I have these wrinkles, how can I fix them? But what can I do now to prevent further aging in the future? So I think pre-rejuvenation, preventative aesthetics, like preventative medicine, I think that's another thing that's going to be huge. And then combining really how you look with all of the wellness, other things that as physicians, as practitioners, we can do so that we can really optimize not just how you look, but you feel, your health, your vitality, because this is, as I always say, I love this Mary Oliver kind of thing. This is like your one precious life to live. The question is always, how do you want to live it? And I want you to have the most beautiful life from the inside out, from the outside in. And tell me what you think about this episode. Tell me where you agree, where you disagree, and what else you think is going to be the future of aesthetics. All right, I'm sending you a lot of love. Thank you for listening. Hey, if you have not yet left us a review, this would be a great time to give us an amazing review, to give us 5 stars, 6 if you can manage, on whatever platform you listen to. Leave us a Google review. Anything really helps, because really, I want this to get out to as many people as possible, because I really think that it's information that needs to be heard. So again, thank you in advance. I love you all, and I will see you next time.
Thank you for listening to the Aesthetic Doctor Podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger, and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.